Hello, today we're going to be performing the final head-to-toe video assessment. I'm going to start by scanning the room to show that there's no note cards, cheat sheets, anything like that. Okay. So before I start my assessment, I am going to check the patient charts. I'm going to come in, I'm going to introduce myself. So hello, my name is Janelle, I'll be your student nurse. I'll be taking care of you today. Then I am going to provide for privacy by closing the curtain or the door. And then I'm going to perform hand hygiene, and I'm now going to identify my patient with two identifiers. Okay, Bruce, please. What's your full name?
Stephen John Clemick.
And date of birth?
12/13/1985.
Okay, and do you know where you're at?
Silverwood.
And who's the president?
Donald Trump.
Alright, my patient appears to have an ANO ×3. He's alert and oriented to time and place. So as I start my assessment, what brings you in today?
Checkup.
Are you in any pain?
No.
Okay, no pain, that's a good finding. So as I begin my assessment, I'm noting that his head is normal cephalic. His hair appears to be evenly distributed on his head, his eyebrows, his eyelashes. His skin is true to ethnicity. I am noting that I don't see any lesions, masses, lumps, anything of that sort. So have you experienced any headaches recently?
No.
Have you had any head injury in the past?
No.
Okay. And does anybody in your family have a history of dementia or any type of memory loss?
No.
Okay. So I'm going to start by palpating my patient's head. I'm going to feel for skin texture or hair texture, thickness, distribution. I didn't feel any masses or lesions. There was no sign of any eggs or bugs. His hair was nice, thick. It was full. It was distributed evenly. So having nice clean hair, that is one sign to me that he is well groomed. As I look at his face, I am noting that his nose is midline to the rest of his facial features. I'm going to begin by talking about cranial nerve number 1. So to test cranial nerve number 1, you would provide a familiar smell such as coffee, have them close their eyes, place it under their nose, have them identify it, and if they are able to, then cranial nerve number 1 is intact. But today I'm just going to ask a couple questions. Have you had any changes in smell or taste?
Nope.
Okay. Can you put one finger over your nostril and breathe in and out? And the other side? Okay, patency is even on both sides, that's a good finding. I'm just going to take a look inside your nose. Hold that for me. Okay. There's no signs of deviation or perforated septum, so that's a good finding. His turbinates were visible. It was nice, pink and moist. There was hair in there that was evenly distributed, so that's a normal finding. And you said you haven't had any changes in smell or anything like that?
No.
Okay, so we're going to say cranial nerve number 1 is intact. Okay, I'm now going to go ahead and move to the ears. I'm noting that the ears align with the outer canthus of the eye. So that's a good finding. I'm going to take a look inside your ears. Have you experienced any hearing loss or change in hearing?
No.
Does anybody in your family wear hearing aids or have any hearing disabilities?
No.
Okay. As I looked inside his eyes, I didn't see any oversecretion of cerumen, no foreign bodies. It looked nice and clean, so it's another sign of that he's well groomed and has performed self-care. Let me know if you feel any pain or tenderness. I'm going to push on the tragus and pull up on the pinna. I'm going to palpate the massoid process. Is there any pain or tenderness?
No.
Okay. Alright, so to test cranial nerve number 8, you will perform the whisper test, which I will get to in a few minutes. And right now I'm going to perform the Romberg test. So can you please stand up for me? Okay, and close your eyes. Okay. I'll go ahead and walk to the end of the bed and back. Okay. Let's sit down. So he had a normal Romberg test. He didn't sway when he closed his eyes, and as I had him walk to the end of the bed and back, I was noting that his gait was nice and stable. He had nice swift movements. His hips glided. I didn't hear any cracking, so that's a good finding. Okay. So for now, cranial nerve number 8 is intact, and we will get to the whisper test in a few minutes. Now, I'm going to go ahead and inspect my patient's eyes. Just looking at them, they are symmetrical. The iris are round, greenish hazel in color. I'm going to check Perla. The pupils are about 4 millimeters, and between 3 and 4. That's about a normal finding. Have you experienced any vision loss or blurred vision?
No.
Do you wear any contacts?
Nope.
Does anybody in your family have any history of glaucoma or eyesight changes?
No.
No? Okay. That's a good finding. Now I am going to have you follow the pen light with your eyes, please. Okay. My patient was able to follow my pen light to all 6 cardinal gazes, so that's a good finding. I'm going to say cranial nerves 3, 4, and 6 are intact. As he followed my pen light, his eyes didn't shake. They were able to follow it nice and smoothly. I'm now going to check direct and consensual constriction. Just look straight ahead. Okay. His pupils did dilate both directly and consensually as I shined my pen light into his eyes. So that's a good finding. And next I'm going to check accommodation. Can you look at the wall, please? And look at my pen. Okay. His eyes were able to accommodate and adjust to my pen, so that shows me that his Perla is all intact. There's no issues with his eyes, so that's a good finding. Okay, I'm going to pull down your eyelids. And then I'm going to pull up. Okay, the conjunctiva are pink and moist. His sclera are white, they're clear. No signs of irritation or redness, so that's a good finding. I believe that is all but the eyes. So I'm going to now go down to your mouth. Looking at his lips, they look nice, pink and moist. Can you open your mouth and say ah?
Ah.
Can you swallow? Okay, my patient was able to swallow, and when he opened his mouth and said ah, his uvula and soft palate both rose midline at the same time. Just go ahead and open up and take a look inside. Okay, can you pull down on your bottom lip? Okay, and then up on the top lip. Okay, as I looked inside, I was looking at his teeth, which are white. They're all intact. There's no fillings or any signs of cavities in the past. His gums are pink and moist, no signs of gingivitis. His tongue is pink and moist. Both his soft and hard palate were moist as well. His tonsils were in the back. I'd say they were at about a +1. They weren't real swollen or anything like that. His buccal mucosa was also pink and moist as well. Okay, and you said you haven't had any changes in taste, right?
Correct.
Okay, can you please repeat the words light, tight, dynamite?
Light, tight, dynamite.
Okay, and stick your tongue out. Point it out. Okay, cranial nerve number 12 is intact. He was able to stick his tongue out and it went midline. Okay, can you raise your eyebrows, please? And puff out your cheeks? Okay, I didn't see any signs of paralysis, no signs of stroke, so I'm going to say cranial nerve number 7 is intact. I am now going to palpate his frontal sinuses. Let me know if you feel any pain or tenderness. Any tenderness?
No.
Okay, I didn't feel any puffiness or anything like that. Okay. I am now going to palpate my patient's lymph nodes, starting with the preauricular, postauricular, occipital, submental, submandibular, consular, superficial cervical, posterior cervical, supraclavicular, and tilt your head to one side. And then you move the sternomastoid muscle to feel the deep cervical. On the other side. I was not able to palpate any lymph nodes, which is a good finding. If you were to palpate them, you would want them to be soft and mobile. If they were hard and immobile, that could indicate an infection or some type of lymph node disease, and that would need to be checked out further. Okay. I'm now going to test cranial nerve number 5. Can you open and close your mouth for me? Okay. And there was no popping, so now I'm going to check his sharp and dullness sensations on the face. I would like, when I touch your face, I want you to tell me if it's sharp or dull and where I'm touching you. So close your eyes for me.
Dull cheek. Sharp cheek. Sharp forehead. Dull chin. Dull nose.
Okay, my patient was able to identify where and the sensations that I was touching him on the face. So cranial nerve number 5 is intact. And to test cranial nerve number 2 with the eyes, you would use the Snellen chart at the doctor's office, but we don't have one of those here. And my patient had already stated he hasn't had any changes in eyesight, no blurred vision or anything like that. So cranial nerve number 2 is intact. Can you look up and swallow for me? Okay, at that point I was looking at the thyroid. I didn't see any signs of a goiter or an enlarged thyroid, so that's a good finding. So can you shrug your shoulders for me? Okay, so cranial nerve number 11 is intact. Can you turn your head against my face? Your face against my hand. Okay, the other way. Okay. So his neck muscles seem to have nice strength, so that's a good finding. I'm just going to go ahead and review the cranial nerves real quick before I move on. Cranial nerve number 1 was identified familiar smell. Cranial nerve number 1 was intact. Cranial nerve number 2 would be the Snellen chart. He said he hasn't had any changes in eyesight. Cranial nerve number 2 is intact. Cranial nerves 3, 4, and 6 was the 6 cardinal gazes. My patient was able to smoothly follow my pen light to each 6 areas. So cranial nerves 3, 4, and 6 are intact. Cranial nerve number 5 was the TMJ and the facial sensations. He was able to identify all face sensations, and there was no popping in the jaw. So cranial nerve number 5 was intact. 7, I had him raise his eyebrows and puff his cheeks. There was no sign of stroke, paralysis, anything like that. So cranial nerve number 7 was intact. I did part of cranial nerve number 8. I did the Romberg test, but I still have not gotten to the whisper test, but I will get to that. 9 and 10 were intact. I had him open his mouth and say ah and swallow, showing me that those were intact. His uvula and soft palate rose midline. Cranial nerve number 11 was shrugging of the shoulders. He was able to perform that, so cranial nerve number 11 is intact. And then cranial nerve number 12 was light tight dynamite, having the tongue stick out midline. He was also able to perform that as well. Okay. Now I'm going to go ahead and assess my patient's upper extremities. First, I'm going to start by feeling. His skin is nice and dry. It's warm. His hair is evenly distributed. I do see some moles. Do you regularly perform self-examinations of your skin?
No.
Okay, and do you know how to perform an examination of your skin?
Not really.
Not really? Okay, so every so often, so like every other week or every month or so, you need to be checking from head all the way down to your feet, including the bottom of your feet, looking at your skin for any new moles, changes in moles, or any lesions or rashes or anything like that. So do you know what to look for an irregular mole?
No.
No? Okay, do you know the ABCDE rule?
No.
No? Okay. So when you're looking at a mole, you want to look at the size, shape, the color. So the ABCDE rule, A is for asymmetry. Is the mole symmetrical or is it irregular shape? B is the border. Is it circular, oval, or is the border kind of jagged and irregular? C is the color. Your mole should be brown, a light brown or tan color. If it's black or purple or blue or anything like that, that should probably get checked out. D is the diameter. How big is the mole? If it's like a quarter size, that definitely would need to be looked at. But if it's small and regular, then it might be fine. And then E is elevation. Has the mole, is it flat or does it raise up? Has it moved? Anything like that. Okay. Do you use sunscreen?
Yes.
Yes. Okay. Does anybody in your family have skin cancer or any skin diseases?
Not that I know of.
Nothing, no. First, I'm going to go ahead and inspect your upper extremity strength. So go ahead and squeeze my fingers. Okay. Go like this. I want you to push against my hands. Okay. And then pull. Okay. Upper extremity strength is nice and strong and equal in both sides, so that's a good finding. I am now going to check his capillary refill. Yeah, please. Okay. It should be less than 3 seconds. About 2 seconds. Okay, on the hand. Okay, they were all less than 3 seconds, so that's a good finding, indicating my patient has good circulation all the way down to his hands. Next, I'm going to go ahead and check his radial pulses. Those are equal bilaterally plus 1. They're not super strong, but I can definitely feel them. I'm going to go up to the brachial pulses. Okay, those are going to be equal bilaterally plus 1. Again, they're not super strong, but I can definitely feel them there. You can move your shoulders around, your elbows, the wrists. Okay, his range of movement seems to be nice and smooth. No restrictions there, so that's a good finding. Okay, just look up for me. I am now going to palpate my patient's temporal arteries. Those are equal bilaterally plus 1. It's not super strong, which is a normal finding. I'm now going to palpate the carotid arteries one at a time. I'm going to say those are equal bilaterally plus 2. It's a nice strong pulse coming right from the aorta. Okay, next I am going to listen to his carotid arteries for any signs of bruit or a whooshing sound. So when I place the stethoscope, I want you to inhale, exhale completely, and then hold. Okay, go ahead. I might do so on the other side as well. Take a breath if you need it. Okay, I didn't hear any whooshing sounds or any signs of bruit, so that's a good finding. Okay, now I'm going to go down and I'm going to start inspecting his anterior chest first by feeling it. It's nice, dry, it's warm. I'm going to palpate for crepitus, which would be a crackling sound of air underneath the skin surface. No signs of crepitus, so that's a good finding. Now I'm going to map out my lung field so I can begin percussing. It's going to start right above the supraclavicular region, so right above the clavicle, and you're going to go down all the way down to the 5th intercostal space. Okay. So I'm up here. I'm going to start by percussing. It should sound resonant. Okay, please. I'm going to go right right along to the side to get this side as well. Okay. It was resonant throughout the entire anterior lung field, so that's a good finding. I am now going to auscultate using the bell of my stethoscope, listening for any wheezes, rhonchi, or anything like that. So every time I move my stethoscope, just take a nice big deep breath.
Alright.
Okay, his anterior and side chest walls seem to be clear. I didn't hear any adventitious sounds, no weasels, rhonchi, rails, anything like that. So now I'm going to auscultate for heart sounds on his anterior chest, going from the second intercostal space, right sternal border, which is near the aortic point. Then I'm going to go to the second intercostal space, left sternal border, called the pulmonic area. And then I'm going to go down to Erb's point, which is the third intercostal space, left sternal border, down to the tricuspid point, down at the fifth intercostal space, left sternal border, and then I'm going to end with the mitral area, which is the fifth intercostal space, mid-clavicular line. And this time I'm going to be using the diaphragm of my stethoscope. Okay, so to find the second intercostal space, you're going to find the sternal notch, go down the angle of Louis, and right into that second intercostal space. Okay, then we're going to do the same thing on this side. I'm just going to go down one to the Erb's point. Okay, and now I am going to go down to tricuspid. And then I'm going to end at the mitral. Okay. I didn't hear any extra heartbeats, which is a good sign. S1 and 2 were nice and clear, loud, strong. His rate and rhythm was nice and regular. Nice bounding pulse all the way through. Okay. Also, looking at the fifth intercostal space on the left side, you're looking for any heaves or lifts, which would indicate maybe malnutrition or even an enlarged heart. So I didn't see anything like that. So that's a good finding. Can I have you turn around, please? I'm now going to inspect my patient's posterior chest wall. Just looking at it, I don't see any rashes, lesions, anything like that. So I'm going to first start by palpating for crepitus. And it's typically at the top since air rises, but it is possible to be a little bit lower as well. Okay. No crepitus palpated. I'm now going to test tactile fremitus. Please repeat 99 as I move down your back.
99, 99, 99, 99.
Okay, and with that, the posterior lung field is from C7 all the way down to T10. And to find T10, you locate the bottom of the scapula, which is in line with T7, and you go down 1, 2, 3. So as I went down, I went all the way down to T10. Next, I am going to check symmetrical lung expansion. So I'm just going to pinch his back and watch his lungs expand. I'm just going to adjust the camera. Okay. So go ahead, go down, find that T10, and push in together, and take a nice deep breath for me. Okay, there was symmetrical lung expansion. If one side were to go out more so than the other, that may indicate a pneumothorax or some type of other disease like that. So now I am going to percuss the same lung field, starting right at the apices of the lungs. And you're going to come in because you don't want to percuss over the scapula. It'll be dull. Okay, it was nice and resonant. I didn't hear any dullness, no tympanic sounds, so that's a good finding. I'm now going to auscultate in the same pattern on the posterior chest using the bell of my stethoscope. So take a deep breath every time you feel my stethoscope move. Okay, I didn't hear any rales, bronchi, no adventitious sounds, which is a good finding. His lung field was nice and clear. Okay, and now that I have him turned around, I'm going to do the whisper test to finish testing cranial nerve number 8. So just tell me which side you hear noise on.
Right. Left. Right. Right. Left.
Okay, so all but one of those he was able to identify the correct side, but I'm going to say cranial nerve number 8 is intact. Go ahead and turn around for me. Oh, I did forget to check AP diameter while he was turned around, so I can do that now. Let me see. So it should be a 2-to-1 ratio, yes. Okay. We have one of these. And it should be one width or one depth to 2 widths, and he does appear to have a ratio of 2-to-1, so that's a good finding. Okay, and does anybody in your family have any history of cardiac disease?
No.
Have you recently experienced any chest pain, shortness of breath,
No.
fatigue? Okay, so that does match up with all my findings. I didn't hear any irregular, abnormal findings, no adventitious sounds, so that's a good sign. Next, we are going to go ahead and move down to the abdomen. Have you had any changes in your diet recently?
No.
Okay, and have you had a good appetite lately?
Yes.
Okay. How would you describe your diet? Poor, good?
It's good. Not the best, but not the worst.
Okay, and what did you eat in the last 24 hours?
Donut and a chicken parmesan with some pasta and garlic bread.
Okay. Have you eaten any fruits or vegetables in the last 24 hours?
No.
Okay. So I would probably say that my patient needs a little bit of nutritional advice and guiding. It is important to eat food from every food group to make sure that you're getting all the nutrition you need. Okay. When was your last bowel movement?
This afternoon.
Okay, and would you say it was regular in shape or size and color?
Yes.
And was it formed?
Yes.
Okay. Go ahead and lay down for me. At this time, I'm going to check for JVD. I'm noting that as he lays down, there's no jugular vein distension. Go ahead and set up at a 45-degree angle for me. Okay, there's no pooling of the blood, which may indicate, if there was pooling, it would indicate a cardiovascular disease. But there's none of that, so go ahead and lay back down. Alright, so now I'm going to inspect his abdomen. Looking at it, there is a little bit of hair that's evenly distributed. I don't see any masses, rashes, anything like that. His stomach is flat. There's no distension, no signs of malnutrition, so that's a good finding. And before you do anything with the abdomen, you're going to auscultate for bowel sounds first, using a stethoscope. And I'm going to start in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. My patient has a normally active bowel sound, so that's a good finding. Normal bowel sounds will be anywhere from 5 to 35 sounds per minute, and my patient does fit that, so that's a good finding. Next, I'm going to auscultate the aortas in my patient's abdomen, starting with the abdominal aorta. And I'm going to be looking for any signs of bruit, which is a whooshing sound. I'm just going to bring this a little closer so you can see. Where am I supposed to be? Okay. So I'm going to start up here with the abdominal aorta. Okay. Then I'm going to go down to the the right iliac aorta, left iliac aorta. That's the right iliac aorta. And then the right renal aorta. Then the left renal aorta. You would also auscultate the femoral aorta, but we're not going to do that. I did not hear any whooshing sounds or any signs of bruit, so that's a good finding. Now I am going to percuss, starting in the right lower quadrant in a V-like pattern. Now I'm on the upper right quadrant, I'm going to the left upper quadrant. And the left lower. Okay, so throughout the abdomen, my patient sounded nice and tympanic, except for in the right upper quadrant, I did hear a little bit of dullness, which would be a normal finding since that's where the liver is, but other than that, it was nice and tympanic. I'm now going to perform a light palpation of the patient's abdomen, starting in the right lower quadrant, going to the right upper, and then the left upper and left lower. Okay. I didn't feel any masses, anything like that, so that's a good finding. At any point in time, did you have any pain or tenderness?
No.
Okay, so again, that's a good finding. Now that I have you laying down, I am going to go ahead and perform some lower extremity strength. Okay. So looking at his lower extremities, I am noting that the hair is evenly distributed. The skin is dry and warm, so that's a good finding. Can you point your toes to the ceiling? Okay, and then push them down. Okay. Can you take your right heel and run over your left shin? Okay. And the other side. Okay, my patient was able to perform that, so that's a good finding. I'm now going to check the capillary refill in his toes. Okay, capillary refill was less than 3 seconds, so that's a normal finding. I'm now going to go ahead and feel for his popliteal pulses. Those are equal bilaterally +1. I didn't feel them super strong, but I could feel them. It would be a normal finding not to be able to locate those. They are pretty deep, and sometimes it can be hard to locate. If you didn't feel those, then you're going to go down to the posterior tibial. Those are equal bilaterally +1. And then you're going to go down to the dorsalis pedis. Those are equal bilaterally +1 as well. I'm now going to test the reflex in the bottom of my patient's foot, and it'll tell me if he's able to feel sharp or dull sensations. Okay, those toes, his right foot did, or his left foot, I'm sorry, his toes did spread. I'm going to try the right foot one more time. Okay, his toes did do the nice little spread as well, so my patient has a nice reflex in the bottom of his feet. Okay, go ahead and sit up for me. Okay, go ahead and lift your legs against my... Okay, my patient's lower extremity length has shown to be nice and strong, so that's a good finding. So throughout this entire assessment, my patient has remained, he has had good posture, his facial expressions have been appropriate, he has been able to respond, his eyes did blink in response, he was able to perform motor commands, his speech was nice and clear, it was appropriate. So on the Glasgow scale, I would say he was about a 15 out of 15, so that's a good finding. I have assessed his skin all the way from his head down to his feet. I haven't found any abnormalities, not in the skin, range of movement, hair distribution, lung sounds, nothing like that. Everything was nice and good. So I believe that's all.